Good afternoon, good morning, good evening, depending on where you are located. This is Dr. Deka Ifobi, board certified neurologist, functional medicine provider, health and wellness coach. We're going to talk about seizure, mainly first aid for seizure, mainly seizure alert. Meaning, if you have a loved one who has seizure or epilepsy, and they happen to have the grand mal seizure or generalized tonic-clonic seizure where they become unresponsive, they may shake, they may stiffen, they may foam from their mouth, they may urinate on themselves. If you have someone with such a seizure, when do you actually initiate the emergency response system? When is it important that you take them to the hospital? So if a patient has loss of consciousness that's lasted for more than 5 minutes, you definitely need to call 911 or your local emergency number. If they are not responding to any rescue medications that you have, like some are like nasal medications, or some are rectal suppositories, if they're not responding to those and they're still seizing, you definitely need to call 911. If they have difficulty breathing or they are injured, they might have fallen during the seizure, hit their head, injured themselves, you need to call 911 or your local domestic emergency response system. If they are pregnant, you absolutely need to call 911. If this is a new onset seizure, meaning they've never had a seizure before, they don't have a history of a seizure, and all of a sudden they go into a seizure, you need to call 911. And last but not least, if the seizures are becoming multiple, meaning they have one seizure, there's no recovery in between, they have another one, there's no recovery in between, then you absolutely need to alert your emergency response system, especially if it's lasting more than 10 minutes. And if someone is in the pool or in water, in the shower, and they have a seizure, then it's important that you contact your local emergency response system, because there's a high risk of aspiration, meaning they choke on the water. The water can get in their lungs. They could develop what we call aspiration pneumonia, and that's not a good thing. So that's the first aid. When do you call emergency system for seizures? On our next video, we'll talk about what you do for the person who is seizing. Have a beautiful day. Thank you very much.